Well, unfortunately, the answer is yes. There is. It does tend to run in families. If you have a first-degree relative, so that would be a brother, father, or I guess son, who has prostate cancer, then their risk is roughly doubled, and the more relatives you have, the higher that risk goes up. So we would recommend that your son get screened for prostate cancer. The recommendation for screening has sort of come and gone. Currently, it is okay in the U.S. to talk to people about screening for prostate cancer, and you have to do a shared decision, so it's not something that should be done without some discussion beforehand. I would, interested to hear what Dr. Lutz says. I would typically recommend that to be done. And age 50 is now the time that when it's okay to start screening. I would typically do that earlier, at least with a PSA in their late 30s or early 40s, maybe.
And you're the first person to openly say that. Because we are now seeing a significant increase in younger men getting prostate cancer, men in their 40s. And if you have a familial risk for the disease, there's two reasons why you should get your first PSA at probably around age 35, because it's pure. It's not affected by benign enlargement of the prostate, and it kind of gives you a baseline, and it may even give you a window into what your risk is eventually down the road. There was just a recent article showing that men of African descent, if their PSAs are 1.7 or greater, they're at high risk for metastatic disease or very aggressive prostate cancer in their lifetime. So your baseline PSA may be your best warning or best indicator of what your future risk is. And so what I tell a lot of young guys is that you can come in and even skip the rectal exam if your PSA is below 1. I'm okay with it, because I don't know how many prostate cancers you've diagnosed with PSA below 1.
It's very rare.
Very rare.
Yeah.
So that's how I encourage young men to get screened. You know, come in your 30s, get that baseline PSA, and if your PSA is below 1, then there's different organizations that talk about the periodicity of how often your PSA should be repeated. It should be annually, it should be every 4 years, every 5 years, every other year. A recent study showed that the ideal periodicity to get a PSA rechecked is every year. They showed that every 6 months was too much, and anything more than a year was probably not enough. But they were talking about the true screening age population, not what I call the pre-screening population. So if you're going to get that, talk about your sons, I'm talking about around 35, get their baseline. If it's below 1, they can probably wait 5 years for their next PSA. But that's really going to be up for debate. That hasn't been proven out.